Members of the media, members of the public. We have with us this morning Dr. Elizabeth Ferdinand, who is one of the coordinators of the National Vaccination Program. And our focus this morning is going to be on the next phase of the National Booster Program. We are inviting members of the media and where necessary, members of the public who may have questions to call us. Well, the members of the media are here with us via Zoom, but members of the public can WhatsApp us at 256-1023. Let me therefore introduce to you Dr. Elizabeth Ferdinand as she outlines the next phase in the National Booster Program. Good morning, Dr. Ferdinand. And just remember to unmute your microphone.
Good morning, David, and good morning, everyone. Well, this morning, I'm just going to tell you what we're planning. And as I think you've already heard, we are planning to introduce a booster dose, that is a third dose of AstraZeneca vaccine to those persons who have already been fully vaccinated with 2 previous doses. Now, these persons should have completed their second dose by the end of April this year. So that means roughly those who started in February and March to have their first doses. That's one condition. The second condition is that they should also be over 70 years old. We're going to start with the older and more vulnerable persons initially, those persons who might have immunocompromised situations, and frontline, very frontline healthcare workers. Now, I must stress that this is entirely optional. It is just that we are offering it at this time. As you know, our numbers of cases is escalating daily, and far too many Barbadians are getting COVID. So we are trying to give that extra boost to especially the older persons at this time. We will talk further as it progresses, but that's the basic message this morning.
There is someone on the call who has something else running in the background. It looks as though maybe television or something else that is running in the background, and it is keeping some noise. So can you turn that off, please? Any questions at this time for Dr. Ferdinand?
Hi, good morning. Randy Bennett. I'm from Barbados today. Just one quick question. I remember back in August, I spoke to the Chief Medical Officer, Dr. George, and at the time he said that health authorities were not interested or they were not looking towards the booster at this time because there was still a large population which was unvaccinated. Obviously, since then, we've had an uptake in the vaccination numbers. So is it safe to say that the health authorities are at a point where they're satisfied with the vaccination rate in terms of the percentage, and that's why they decided to move towards the booster shot?
Let me say that I'm not happy with the uptake rate. The uptake rate is still very slow. And yes, we were waiting until everybody was completely vaccinated, but then we would be waiting and waiting and waiting because not enough people are coming forward. So we have decided to go forward, especially, as I said, at this time when we are getting so many cases. And some of the people who have been fully vaccinated, a few of them are also coming down with the COVID. Thank God, not as a serious disease, but they're still catching it and increasing our numbers.
And just one more question. You had also indicated that we had some vaccines which were near to the expiration date. Are those vaccines being used in this particular drive, or were we able to get rid of those?
No, we still have some to be used, and we're hoping that we will use up quite a big portion of what we have by the end of the 31st of October. But we have other vaccines, AstraZeneca, which is going to expire in December. And so we have to not only get the first doses used up, but also second doses. And with an interval of 8 weeks between the two, you can understand that the vaccines that are expiring in December, we're going to have a hard task to get all of them used up by the end of December.
Dr. Ferdinand, how would you respond to members of the public who may have some concerns or questions about the continued effectiveness of their vaccine since third doses are now either being given or are now necessary? Who may have questions about, I've got my 2 doses, I haven't gotten the third, but they're giving a third to others, so is my vaccine still effective?
Well, what we can say is, you remember, look, this is a new disease. We are learning as we're going, and we're trying to keep on the edge of technology in the sense of we're trying to keep up with this disease, who seems to be just racing ahead of us. So we know that in many other cases of diseases that vaccines are not 100% effective all the time. So there's always a necessity to do a booster. We do boosters for polio. We have 5 and 6 different, doses of polio. We have boosters for tetanus. We have boosters for most of the vaccines. So this is no different. When we started, we did not know if we would need boosters. But what is happening, we see it in America, we see it in Canada, in UK, all around, that there's breakthrough big cases. In other words, the cases are occurring in higher numbers again, and even in people who are vaccinated. So it means that the immunity is waning, and we're using a 6-month period as the waning period. So we're using a booster to stimulate and boost those people who have already had 2 doses. So it's a waning of immunity, really, breakthrough of cases that is happening at the moment.
Stetson, if I may add,
to identify myself, sorry, Stetson back from Starcom. David, if you were coming in.
Yes, we should also point out here that we are looking primarily at 3 categories. We are looking at people who are over the age of 70, and that has a lot to do with what has been borne out by the science over the recent months, which has to do with the fact that if there is to be a waning, then this has been linked more to people in the older age groups, people who are immunocompromised, and frontline workers who are exposed to high risk because of high traffic. And central to all of this is the fact that especially the elderly, this is something that they will be able to opt for. It is encouraged, but they will be able to say whether they want it or not. And ideally, we recommend that you consult with your doctor so that, because, it's different strokes for different folks. Some of the, I know there's a lot of literature out there, and I'm sure that there are those people who have looked at what AstraZeneca said recently on the BBC and all of that. And that's why we are focused more on people who are in the older population, the more vulnerable people in the country at the moment. And we are not recommending that the younger people go after this unless they are in that high risk category as workers.
Okay, well, but that understood but taken, but I want to clarify, crystallize, and confirm what I thought was some very important points made by Dr. Ferdinand. One is that there seems to be, you're admitting that, or rather confirming that the potency of the vaccine will diminish over time. And therefore there's a risk of, and I think you did use the word breakthrough cases, because you have some people now, fully vaccinated people who have both contracted the virus, which obviously they can, and also passing away, sadly. So you're confirming that the potency may be declining, that as a result, you have some breakthrough cases, and therefore there is a need for a third booster shot. for a booster shot, rather, a third shot. And then beyond that, can you then again, I think you may have dealt with it a little earlier, but I will paying close attention then. Just confirm for the rest of the public who may want to know, again, when will and how will the booster shot be available for the broader population?
Okay, let me begin by saying, yes, you are correct. And remember this, as I say again, this is new territory. We have found, and when I say we, I mean the world has found that there is some waning of the potency of the vaccine. In other words, it's not the vaccine itself, it is our immune system that has waned off, okay? So yes, you're correct on that. And to overcome that, we have to give them a booster. And this is nothing new. This has been going on in all the other vaccines. We always, most of the time, 99% of the vaccines, you have to give a booster. All right, so that's that. Now, the other question you asked is about how are we going to roll it out? So simply what we're doing, we have made one site, one of our fixed site, which is the Masonic Lodge site. We have sort of allocated that to persons who are in this category. So we are hoping that they will come forward to that site, but we haven't left it at that. We are offering it at all the other sites. We don't want overcrowding. We don't want bunching. We don't want a repetition of what we had last year, February. We've gone a long way since then. So we're trying to roll them out and ease them in a more comfortable atmosphere. So that's why we've made, at least at this point in time, one site devoted to them. We are hoping to get another site going, but our problem is staff. We are stretched thin. So because we're out in the community, we're at stationary sites, so we're really having it rough. And that is why we can't open 2 and 3 sites just for these booster doses. So for this week, at least, I'm working on next week to see how we can do it. Also, I'm looking to see what the response is like, because as I say, I don't know who is going to come forward. It's not mandatory. It's just as David has just said, it's an option that you can come and get it. We're offering it. So we will try to get another site up to make it more convenient for these people. But if not, and they want it, they can go to any site that we're running and make sure that they say it's for their booster AstraZeneca. I hope that answers what you say.
Yes, good morning, Dr. Ferdinand, Wendy Burke, CBC. Now, you mentioned being stretched to capacity in terms of having people to assist with the vaccinations. Now, I remember government had instituted a program to get the medical practitioners on island trained in the administration. If still so overburdened in the system in terms of administering these vaccines, I guess it means the uptake both at the private and the public level is not where you want it to be. So what efforts are being made to push it a little harder?
Okay, well, let me say that, yes, the private practitioners have come on board, and they are doing 2 things. One, they are volunteering to the different sites, because as you know, we've been trying to have a doctor present at all vaccination sites, and this is where they are helping. And secondly, they're going to be doing the shut-ins, and they're beginning this weekend to do the shut-ins. So that's taken an enormous burden off of us of having to go out so that the buses can then devote to community sites. So that answers that part. As far as being stretched, well, they are assisting. They still have to work and make a living, but we've invited retired nurses, retired doctors, or doctors who only do a couple of days a week in their offices to come out, and we have had a good response from the medical practitioners.
You can do that when school is finished.
Just as a
Just wanna
follow-up,
elaborate.
we have all of these persons assisting, etc., but the percentile rate is still not where we want it to be in terms of the overall population and trying to get toward that point of herd immunity.
Well, I agree with you, and that's why I began by saying I'm not happy with the uptake from those persons who have not had even a first dose. Far less, well, some people are coming up for their second doses, yes, but a lot of people, there are 50% of our population who have not come for their first dose. And the vast majority of people dying are unvaccinated. You know, I think we've had one case who might have been vaccinated, but this is not good enough. It's not good enough in any country. And we keep pushing. We have done, I mean, I would love to hear some more ideas on what we can do, and we look at the feasibility of doing it. But we've opened these fixed sites. We've gone out to communities. We have loudspeakers. We have influencers, people on our behalf trying to encourage people to come forward. So, and I mean, we hear it, it's on the airways night and day. So I really don't know what more we need to do. If it is education or what, I mean, I on Saturday I was down in Bathsheba on East Coast Road and people were saying, oh, we're waiting. And I'm asking, what are you waiting for? To get the disease and die? They're waiting, they can't answer me why they're waiting. So they're waiting. So while they're waiting, we have to still provide the service, which we are joyfully doing. We're there, the nurses and the doctors and the staff, the admin staff, records people, we are there at our posts waiting for everyone to come. So please, if you can tell us what your ideas on how we can improve the uptake, I would be very happy.
But here's a response from somebody who sent a text. They would like the health personnel to address the matter of adverse reactions to AstraZeneca and this booster shot. I then asked, what do you see as those adverse effects? The person says, I'm one of those persons. Honestly speaking, I'm not prepared to have that booster shot because I'm still receiving treatment and still experiencing the consequences of the vaccine, said the person. They said that they've been suffering nerves and muscle issues and constant pain, amongst others. And this person says that there will be 61 next month. So it is stories like those that we have to address. How do you respond to that?
Well, David, it is no doubt that there are adverse reactions, not only to AstraZeneca, but to all the vaccines. There are adverse events to drugs, adverse events to foods, all sorts of things. And we never said that there was never going to be an adverse reaction. Every time patients come up to get their vaccine, nurse tells them what we generally expect is a little fever, a little aches and pains, and that's the usual. But there's always going to be that one person who will have some other further adverse events. We have in place a mechanism where people who have adverse events report them to the Barbados Drug Service, or they go to their doctor or polyclinic, and they then report it to the drug service, where we have a pool of adverse reactions that have been reported. They are then analyzed. There's a committee that looks at them. There is an investigative team that goes out and visits these serious cases. We really only visit the serious or the moderate cases. So, and they investigate it, and then the committee looks at it and see whether it could have been caused by the vaccine or not. We are in negotiation now with the Ministry of Health. Right now, the acting CMO has been speaking to me on a case where we can look to see if what can we do to help the person. So, because sometimes they need further tests, the investigative team might go and say, look, I need you to have X, Y, or Z tests. And the patient says, well, look, you know, I'm not working. I don't have the money. So we're looking at ways and means to which we can assist those persons. But they are a minute amount of people who suffer adverse events. And in your case, and in that particular person's case, and in anybody who has had a reaction to the first or second dose, no, do not take a booster or do not take the second dose. But we could accommodate you sometimes. If a person has had, say, for example, AstraZeneca as one and had a reaction, I will make arrangements where they have what we call a supervised second dose of another vaccine. And they are done that way because we don't know what the reaction would be after they've had a reaction to the first dose. So that is in place and that is being done. But certainly if you have had a reaction and you don't want to have the second or third dose, don't have it.
Rachel Agard, good morning.
Hi, good morning. Dr. Ferdinand, can you say what the uptake has been for the shut-ins with the Johnson & Johnson vaccination, and if government will be procuring any more for mainstream population or just the shut-ins?
Okay, the situation is that we have not started as yet. So I can't tell you what the uptake is. All we have done so far, as I told you, the doctors are starting this weekend. All we have done so far is that we have been calling ahead from our office to find out, to tell them, first of all, that the doctors are coming, to get the precise directions to their home, and to tell them that we will be offering them Johnson. There have been a few cases that have said, no, I don't want that. I don't want Johnson, I want Astra. So in those cases, we have made a list of people who only want Astra, and we have a small van that we will be going and doing them as shut-ins. So at this moment, I cannot tell you what the uptake will be because we have not really started. That's the first question. The second question is, remember that 7,000 was given to us as a gift from the people of Guyana. I'm not sure what is on order as far as Johnson & Johnson is concerned. We do have 2,000 of that 7,000 earmarked for people who can't have the other vaccines and who desperately want the Johnson. For example, I have some, what you call those people, not farm workers, but people who are going on the labor scheme to America in a short period of time, and they need to be vaccinated, and they can be fully vaccinated, and they've reached out to me, and I've said, yes, there's not a lot of people, I can give you Johnson & Johnson, so you're fully vaccinated before you get to the job in America. So, you know, be flexible. We're trying to accommodate people, individual reasons. People have all sorts of reasons, but individual cases, and anybody who wants to be considered as an individual case can call our number at the office and explain, and we will try to sort them out.
This person wants to know whether mobile units will be going to housebound elderly and handicapped persons to give booster vaccines, and how can they register those people? They say that they have 3 people in the same home in this position.
Okay, well, at this point in time, we have not started to earmark shut-ins for boosters, right? We have to try and finish the first people who are being done by the private doctors. So I suppose they could call the same number and register and say they want a booster, okay? And we will try to accommodate.
I just one quick question there, Dr. Ferdinand. The booster shots, the rollouts began yesterday at the QEH. Would you be able to tell us in terms of how many employees at that institution came forward for the booster shot?
I can't tell you at this moment. I haven't touched base with Sister Connell this morning. I haven't touched base with her this morning.
I have a question. I actually have a question for you, Mr. Ellis. I don't know if you're taking questions in this press conference.
Sure.
But I just wanted your view in terms of you took up this post just over a month ago. I just wanted to hear from you how things have been going since.
Well, to a large extent, I have also been providing a facility for members of the public to communicate with the various departments. There is, for instance, an issue that I think has come up that is very important. And this has to do with both employees and employers are worried about it. As you well know, employees have been placed in isolation or in quarantine. But the big difficulty that they have been facing is that they cannot get the sick certificates in a timely manner. So what is happening here is that the claims are being submitted to NIS late or later than stipulated by the NIS. In these circumstances, employers are also unaware of the status of the employees. So a person may be in quarantine, then they go and get tested. 5 days later, they're positive. So then they have at least 10 days in isolation. They may get a clearance certificate from the doctor, but they cannot get that yellow form. And part of the reason why they're not getting the yellow form is because I believe it has to be delivered within the first 4 days of the illness. The doctors are, first of all, the limited number of doctors involved in this part of the exercise, they are really overwhelmed. And it means that stopping to do the paperwork that is required in all of this is challenging for those doctors. So the net effect is that the employer does not have anything to prove that the employee has indeed been in quarantine or has been in isolation, other than the clearance certificate that this clearance certificate they may get when they come out of isolation. And the employee assumes that because the Ministry of Health has sent them home to isolate or quarantine, that the employer has to pay them. Now, last year, when this first arose, you may recall that the Employers Confederation advised that the workplace's usual sick leave and pay entitlements applied if someone was placed under mandatory isolation by a medical doctor or was diagnosed with COVID-19. And they suggested that the employers may have needed to modify the usual process of reporting sick leave, including extending the time limit for receipt of the sick certificates, and that the employees should advise the employers as soon as possible if they were unable to report for work due to illness. This matter is occupying the attention of both the Ministry of Health and the National Insurance Department, because too many people are being hurt by it, and too many employers are finding themselves in a situation where they are uncertain about exactly what has been happening with the employees. So that's the kind of role that I have to play in all of this, which is to help identify what have been some of the challenges that people out there in the community are facing, and there are many. You have so many people who they're going to quarantine and they have not been able to get to the bank, they can't get food. Again, we have to help facilitate that. So a lot of this relationship is not necessarily going to be on air, but it is dealing with people on a regular basis. And to me, it is a necessary function. Part of it also is helping roll out some of the programs that are related to COVID. For instance, this whole question that we are discussing this morning, which is the booster program for vaccines. We have also had to do a similar thing with making people aware of the home quarantine and home isolation. So that in a nutshell is the kind of role that I've been playing since taking up the appointment.
Dr. Ferdinand, can you say how the receipt of the Sinopharm by the public has been going? We knew it was a bit low at first, and then we were informed that we received a second tranche. But how has that been going with that particular vaccination?
Well, unfortunately, the uptake is very low and continues to be very low. I can't say anything more on that, really. It's just that people, I mean, it's like when we got the Pfizer, everybody rushed for the Pfizer, and the uptake for AstraZeneca and the Sinopharm went down. So similarly, right now, it's in the same position. People are coming forward for the AstraZeneca, but not many for the Sinopharm.
I shouldn't, sorry, I just wanted to indicate to you, though, that in all of this, we need to remember that the Prime Minister has announced a program of safe zones and guidelines for health workers in the first instance, where people will be encouraged to either be vaccinated or they will have to take the tests on a regular basis. As it relates to those two issues, they are now being finalized, and I expect that you will hear something about them very soon.
Just one quick question, Dr. Ferdinand. Just wanted to know how many booster shots are available at the moment.
Oh, we have at least about 15,000 that are expiring in October, and we have another 30,000 doses that will expire in December. So we have 45,000 doses that can do both first, seconds, and boosters in AstraZeneca.
Any further questions? Let me see, I think I have one here from somebody among the public. If someone is shut in and unvaccinated and wants a first dose this weekend, what is the procedure? What do they do? Is there a number to call? They say that this household that they know of has one shut-in, and the three younger people who live there say they would get the vaccine if the doctor comes and vaccinates the elderly shut-in who is unable to come out. So there's some people who you say you wanted suggestions. Some people are calling for more of that outreach, the community outreach.
Well, let me say that I cannot lay my head on a block that the doctors will get to you this weekend if your name is now put on the list. So we still have quite a few people to visit. That's the first thing. The other thing is, if you can get that person into a car, you can go down to any of the, well, not any, no, you can go to the fixed sites like building number 2, even Masonic that has a drive-through, although we're trying to do only boosters there. But I mean, we can accommodate, we're flexible, we're not, rigid. So if you can get that person into a car, you can go with them and all of you can be done there quickly in a day. But if I put you on that list and you can call into the office and get that and the number, and I tell you the truth, Mr. Ellis, maybe you could give them the number that you have for the office. They can call there and register and say they want a home visit, and we will put them on the list.
That number is 536 8222.
Okay, yes.
It's all the twos, well, 3 twos.
Yeah.
Okay.
I didn't trust my memory. I have it written down, but I didn't trust.
No problem.
So my brain is going, Yeah.
Yes.
So that person, look, you can be accommodated, and it doesn't matter if the doctor comes to the home and there are other people who want it, they can get it.
You have some other questions there. You spoke about how the people can get the booster through the public system. Some people want to know whether it is available through the private system as well?
Yes, well, I have a to-do list, and I will be writing to the doctors who are participating in our office immunization program. I will be writing to them to tell them that they can go ahead, and also that they can order the vaccine, and they can go ahead and give booster doses to the relevant persons. So yes, you can have it done at your GP. But of course, the GP has to be in the program.
There is another question here which asks, how is it that people who are fully vaccinated are still dying?
Well, as far as I know, I think there was only one person. There, there is no proof, or there's no guarantee is the better word. There's no guarantee that because you're vaccinated, you're not gonna die. It's just as, you go on a flight and there's no guarantee that you're gonna get to the end. Something could happen in between. Now, that person may have comorbidities. They might be seriously ill. They might have a cancer on top of a diabetes and hypertension or a bad heart. It doesn't mean that because I've given you a vaccine mean that you're never going to die from COVID. I cannot guarantee that. It's in God's hands. So it can happen. But all I can say is that the proof has shown over this last year that people who are vaccinated, and especially those fully vaccinated, do not get serious complications of COVID, and 99.9% of them will not die from it. I don't know what other way I can explain that.
What are the challenges associated with making it easier for people to get vaccines in their communities?
I'm not quite sure what you mean. You mean,
in other words,
buses?
By pop-ups and that sort of thing. Because that's one of the concerns that people raise from time to time. They feel that if you could get more of the community outreach, especially in circumstances where people are afraid of traveling on public transport, or they don't have enough money to get public transport. So they want the vaccines to come more to them.
But that is what we are doing, David. That is what we are doing. We're going to communities. And in 4 weeks' time, we're going back, because a lot of people had Pfizer. So we are going back now into those communities to give them their second doses. But we find that this last week, going back into some of those areas, the uptake has not been as good. So because they know they can go somewhere else for their second doses, right? So we are going, and we're systematically going through. I mean, we're going to supermarkets, we're going to companies are calling us, we're going out in the community. So if there are communities that really want us to come, they can phone that same number, which is our office number, and suggest. When I was down in Bathsheba this weekend, they said to me, lambings, right? That was, excuse me, one of the areas that were one pop-up area that was suggested. So we're going all over, and we have loudspeakers going out, telling the people that we're in at so-and-so's gas station, or so-and-so's shop, or wherever, pasture, or wherever we are, community center. And we're hoping that the people will come. But I don't know. And we're trying. And the more places we can go, we will go. Just let us know where you want us to come and where you think will be a good area, because I don't want to come for 5 people. I mean, it's just not human resource wise feasible to go to an area, set up, put up a tent, and all the staff going there for 1 or 2 people. It's not, it's a waste when we could be somewhere else doing a better result.
If there's one,
David?
Yes, please, go ahead.
Yes, David and Dr. Ferdinand, just a question here. I know we're trying to encourage the uptake of the vaccines, But should we not be able, today's now the 21st of October, you mentioned 15,000 expiring at the end. Should we not say by the 25th, 26th, be able to get, say, even quarter way in that number or with the boosters? What's the likelihood of having to dump? Or do we have a backup where maybe we can get those doses over to, say, some other island that might need them?
Okay, well, we will look and see what the uptake is like. Whatever is left at this time, I mean, I have been EPI manager for years, and it is very difficult, even if you're being offered the vaccine free, to institute a program where you can use those vaccines to vaccinate people is very difficult. With only 5-6 days, it's damn near impossible, you know? So we are hoping that we will use up all, and unfortunately, if we don't, well, we will lose a bit, right? But remember, this was not in our plan. We had tried to plan out as best we can how we could distribute the vaccines, I should say. But if you get some with a very short shelf life, we call it a shelf life, the best you can do is to try and hold use those up and hold the others that have a longer shelf life. And in this case, we got some that were expiring at the end of October, but we had already got some that were up to December. So what could you do? We had to stop using the December one and start using the October one. So it's a tightrope we're walking, really, to try and manage that we use all of our vaccines. And so far, we have not have to destroy or get rid of any. And this is the first time that we have some. And I'm sure, I have a feeling that we will get through most of them. We will use up most of them.
According to yesterday's figures, we had 118,537 people who have had both doses already. And if you look at that trend, you would see that there are so many people who have been eager from the word go. And I think it must be recognized that we are targeting people who are vulnerable here. We are targeting older people, and we suspect that quite a number of those people are not among the hesitant. And therefore, they have already shown you that they've gone once, they've gone twice. And we expect, therefore, that we will go into this with a greater degree of optimism there. I think where the fight really is, to a greater degree, is among those who have not yet had a first jab, those who are hesitant or who for some other reason cannot take the vaccine or do not want to take the vaccine. And that is where I believe other strategies have to be employed to reach those people, because as you well know, it has implications for the health system. The healthcare system is under a lot of pressure at the moment. We don't want this one to crack in any significant way. Our healthcare workers have been working hard since March of last year, and since September of this year, this Delta variant has really added to their burden. So that's the number one priority. And the second issue that we need to be looking at is restoring the country's economic health. People must bear in mind that at the end of all of this, if we do not get through this situation well, everything that we have available to us could be threatened in terms of the livelihood of so many people in the country. So it's not just about me, but it is, even if I feel that I don't have to worry too much about it, because I know that there are younger people who say they're not afraid to die. But what about the other people who are close to you? Not everybody carries that particular philosophy in life. And as much as possible, we're going to try to see to what extent we can improve this situation. Many people have done remarkably well, because in addition to the 118,000 that we spoke about with both doses, we have 145,885 people who have taken the first jab. So we've come a long way, but we've still got some way to go. If there are no further questions, ladies and gentlemen, I want to thank you very much for taking your time and sharing your questions and your concerns and thoughts with us. And thank you very much, Dr. Elizabeth Ferdinand. Do have a great day.
Thank you very much.
What was the answer for